infectious disease professor at Yale and co-chairman of our Reopen Committee. Dr. Coe's been with us before as we continue to lead with science and public health as we talk about this pandemic, and in particular our schools. I thought it was an appropriate time for Dr. Coe to be here, and Miguel Cardona, since it's in about the end of this week, to be exact, that we've asked all of our superintendents across the state to respond to the protocols that we gave them on how you can think about reopening your schools safely. They're going to give us their feedback. And we just thought Miguel would have an opportunity, our Commissioner of Education, to answer a few of the frequently asked questions as we lead up to that. Just quickly, our COVID-19 daily summary. The numbers are all trending blessedly in the right direction still. We've done 27,000 tests. This is over the last 3 days, by the way. And that's a 0.6% positivity rate. That's the number of people who tested positive for COVID. Again, that's one of the lowest in the country. Sadly, 10 more fatalities, but 12 fewer hospitalizations. And I think you see from some of the numbers we showed you in other states, those states that are really infected, you see that they're reaching capacity in a number of their ICUs and a number of their hospitals. And thankfully, we're in a very different situation here. This next chart is a little misleading because when Josh first showed it to me, I said, oh my God, why are we still in the red zone up there? But what you should know is this is a chart that was put together by the New York Times that shows where you're likely to be wearing the mask. The darker the red, the more likely you are to be wearing a mask. And every place we go, the number one factor in terms of influencing, reducing the spread is wearing the mask. So you can certainly see in that tiny corner of the Northeast that we are one of the darkest reds up there, Connecticut. Thank you very much. And I think you can see the rest of the state rest of the country where people are likely to wear the mask and where they're not likely to wear the mask. And then we broke out the state of Connecticut. Again, the darker the red, the more likely you are to have social distancing and wearing the mask. I think you can see a little lighter in some of our cities, Bridgeport, New Haven, Hartford. So just a reminder that these are places where you can be safe. And by the way, eastern Connecticut there, where there is a very, very low infection rate. I will tell you that we just got off the teleconference with Vice President Pence's task force, which is, pretty helpful. I was very happy to see Dr. Fauci was back, by the way, able to answer questions. Again, he said, what is working in these highly infected states now is the fact that they have not allowed bars to, they've closed down bars, something we never opened. They're mandating masks for the first time, something we did months ago, of course. And finally, they're trying to keep occupancy low in the restaurants. We're at 50%. So these states they're not yet bending the curve, but they may not be going up as fast as they were a couple weeks ago. These are the 4 states that represent 50% of all the infections in this country right now. Florida, Texas, Arizona, and California, which is really Southern California. So what they're doing is what Connecticut has been doing. And it does make a difference. I mean, I was interested in the COVID task force from the White House. They pointed out that if we have about 17 infections per 100,000 population in our state, the average across the country is 140 infections per 100,000. That's across the country. That includes even some of those lower infected places as well. So it shows you what an enormous difference. And in terms of positivity, the number of people who test positive, if we're a little less than 1%, I think we're at 0.8%, Josh tells me, over the last week or two. The average across the country is 9%, more than 9 times ours. So it tells you, A, the impact of wearing the mask and the social distancing and what a difference it has made in a state like ours. This next chart, they also shared with us, they're able to collect a lot of data now that we didn't really have several months ago. And this is just the Connecticut mobility trend. And what they're doing is tracking smartphones. And you can see what happened in early March, mid-March, as COVID hit, the reports came out, and there really was a shutdown. You see how close we got to very little transportation as reflected by the mobility of the phones. And you've seen how over the last 5, 6, 7 weeks, it is trending back up again. But thankfully, as it trends back up, there's not necessarily an increase in infections in our state as yet, but it's just a fair warning out there. I will tell you that we are watching this like a hawk, and they did report in the White House task force that Maryland and Delaware, especially along the beaches, and Virginia are beginning to see some flare-ups. So it's not simply down there in those Sunbelt states. So that reminds me, as I get to this last chart here, that we are going to continue to tighten up on our quarantine on out-of-state travel. I think you know that any of those states that have more than a 10% positivity rate, which is a majority of the states right now, are on a quarantine. And obviously, we have noticed airlines, we've noticed travel agents informing hotels, these are the rules. You must quarantine for 14 days as you come to our state. And what we wanted to do was tighten that up a little bit in terms of what we're telling people to do. So we're going to give you an online travel health form. What does that mean? That means that airlines, travel agents will tell you this is a form you have to fill out before you fly to Connecticut. And we're working with New Jersey and Massachusetts and New York as well, so they can do the same thing. And hopefully that is filled out by the time you land and get to that location. An online travel form, by the way, impacts however you come into our state. You could be driving into the state. You could have rented a car and are coming to the state. You'll be still noticed and held accountable there. We're going to have members of our public health department there at Bradley Airport. This is something they're doing in LaGuardia and Kennedy as well. Just to ask people, you've filled out the form. We'd like to see the form as it's filled out and hold people accountable there. And we know how to contact them going forward. And we are giving a right or an option of having a $1,000 fine for people who refuse to fill out the form or don't obey the protocols. You know, enforcement of that will evolve over time, but we want to send the message loud and clear that as you look at the incredible infection rates in other parts of the country, we know that, you know, COVID came to this part of the country by airplane, and we don't want it to come by airplane again. So we're being particularly strict about how we do that going forward. You know, with that, Dr. Coe is here to answer any questions you may have, you know, as regards where we've been. And I'd just like to ask Miguel Cordon, our Commissioner of Education, just to say a few words with 5 days to go before our superintendents provide their best way to reopen schools. Miguel?
Sure. Thank you, Governor. Glad to be here with you all. You know, I just want to say that over the last month, the superintendents have been working really hard with their teams to establish plans for their districts. And, you know, I want to commend what I'm hearing throughout the communities where we have teachers, parents, board members all coming together. There's processes for local plans to be vetted publicly. And I think that that's critically important, that people understand that the people that are going to be in the schools with your children are making these decisions along with the superintendents and the folks that are running the district. So thank you to the districts, to the superintendents, and all of you who have contributed in some form in the development of the plan in your local community. I want to share that we're continuing our work with the districts to plan for full reopening, knowing that the full reopening plan that allows for students to come in 5 days a week also has a hybrid option. For any family, any parent who feels that they're not ready to send their children to school in person, they have that option. So even with our full operation, there is that hybrid option for families to keep their children learning from home, and we're working on that. There's the other hybrid version where students might be coming to school on a limited basis, so maybe 2 or 3 times a week. That's a second plan that districts are working to develop in the event that the transmission increases. And then lastly, the remote. And we know that many students experience remote learning for the first time the last 3 months. We hope that the second round of it, all the work that's been done to plan it, will result in a better remote learning experience for the state of Connecticut, although, with very little notice, everyone stepped up. We've been discussing remote learning. I've gotten a lot of questions about what does it look like if a parent chooses to keep their children home. We're working along with partners from CAPS, CEA, and AFT to put together some guidance with their input on what that might look like, keeping in mind that we recognize if teachers have students in front of them during the day, we're not expecting a second shift for teachers to have to meet the needs of the learners that are not in the schoolhouse. So that's not easy work, but that's something that we're committed to doing together. Another question, I get a lot of questions about safety. We are leading with safety in mind, not only the safety of students, but also of our staff, of our teachers, of our paraeducators, all of our folks in our building who are part of that school community. And then lastly, I get a lot of questions about resources. Well, this is going to cost money. What does that look like? We were fortunate last week to hear from districts about what they anticipate to be some costs. And just this morning, we're having preliminary conversations with the Office of Policy Management and the governor's team to ensure that what we're hearing from districts is communicated to the governor, because I know the governor is committed also to making this work safely, and we're committed as well. Thank you, Governor.
Hey, Miguel, thank you very much. If I might, I'd just kick it off, Dr. Coe, with you with a broad question, if I could, which is it's been 6+ weeks since you joined us. You devoted most of your professional life to studying infectious diseases. Anything surprise you regarding COVID over the last 6 weeks, what we hadn't expected?
Well, thank you very much, Governor, for the opportunity to come back, and it's surely a pleasure. Let me just, I think so. As we know from COVID, we're learning something always new, and we're always surprised each day and each week. I think one thing that's come out over the last week has been some information from Korea, where they're doing intensive contact tracing. And I think that kind of adds to some of our knowledge, particularly about the subject that Miguel had just talked about, was about children and transmission among children, and how this would affect, for example, if we're having kids go to school. So this, as we know, for diseases, very common diseases like influenza, school children, where infections with influenza virus are actually driven, the transmission in the community is driven by transmission among young children, especially the younger ones. But we didn't really have a good understanding about that in COVID. We always thought that maybe children may have a lower risk of not only getting COVID, but also, and not only getting the severe complications, but also a lower risk of transmitting it to people in their families. So there's a big study from Korea where they're doing intensive contact tracing. They looked at transmission in households and how that, what was the risk among people who are contacts of different people of different ages. And what they found was that children between 10 to 19 years of age spread the virus just as high, and if not higher, than adults. And that makes it all the more important that the types of interventions that Miguel was just went through about how do we keep our schools safe, and what can we do in terms of alternative or contingency plans. Those are exceptionally important steps. And then also the precautions that we need to take at home, for all people at home, and not just children, especially those that have multi-generational homes, where you have elderly people who are much more at risk for the severe complications.
All right, thank you, Dr. Coe. Over to you, Max.
Yes, this question is for Dr. Cardona, since we do have you here. We keep hearing from teachers who are scared to return to classrooms, and they're voicing their concern for social distancing. They watch these news conferences, they see the 6 feet distancing here, but they say that it's not been mandated yet in classrooms. What do you say to that?
I'm sorry, I couldn't hear the question too well. There was a big echo. Could someone repeat the question?
Yes, Dr. Cardona, we're looking to kind of hone in on social distancing in the classrooms, because we're hearing from the teachers who say that it's not yet been mandated in the classrooms yet. What do you say to them?
We do require, as part of the plan, several mitigation strategies. One of the most important ones is obviously the facial coverings. Social distancing also is a part of the plan. Washing hands, cleaning the spaces, intense cleaning so social distancing should be a part of the plan in every school. Plans are due this week, and we anticipate that all districts have looked at social distancing as one of those strategies that they use in combination with others. While it's true that in some places it's more difficult to maintain 6 feet, the expectation is that social distancing is a strategy that's used in all spaces.
And a question for the governor, is out-of-state vehicle traffic being monitored, and is there any indication as to, if it's up?
No, there's no indication that it's up. And as we suggested, we wanted to make sure that we could at least get our forms in front of drivers as well as folks who fly into our state. Overwhelmingly, the out-of-staters from those infected states come by air, by the way. But those that maybe came in from LaGuardia, rented a car, they're going to have their information. They're going to have to fill out the form as well.
News 8.
Good afternoon, everyone. Governor, with respect to the false positives, what is the next step now? I know that the proper people have been identified, but in moving forward, there is another way to get positive tests reanalyzed just to make sure that that they are retested.
Yeah, I'll start on that and then maybe hand it over to Josh if I could. Perhaps you're thinking about the situations in, the nursing home. I mean, the good news for us is we caught it. We had people take a second test. We're able to find those false negatives, I think they were, and that was very important in terms of track that and now be able to get those people properly tested and taken care of. Josh, anything else?
Yeah, that's correct. Just for a broader background for people who may not follow the press release that came out from the Department of Public Health earlier, our state public health lab caught late last week and over the weekend about 90 individuals who had false positives, so people who tested positive but were actually not positive with coronavirus, out of about 2,200 tests performed on a certain instrument that was just put into the public health lab about a month ago. So they've gone back, they've retested all those positive cases over the last month. 90 out of 144 individuals were false positives. So those people have all been notified, their clinicians have been notified, and our public health epidemiology team is working with each of them to figure out the right actions going forward. But I do want to thank our public health team for first spotting the issue and investigating it and notifying the FDA as well as the manufacturer and working to take all the necessary follow-up steps, including, as the governor said, having all those individuals retested. Most important message here for the general public, though, is this is a very small number of false positives over the course of a month. So if you have tested positive generally and you have not heard from your clinician, you should assume that it was a valid positive and accurate positive test and continue to follow the clinical advice to self-isolate as appropriate.
Well, for Dr. Cardona or anyone else, with this happening today, or finding out about it at least, can that have an effect looking forward to the schools reopening, or would it take something a little bit different maybe to tap the brakes on that?
We're looking at overall transmission trends in Connecticut to make the decision. Actually, we have a team from the Department of Public Health working with folks from our agency to try to identify more clear thresholds. We're monitoring everything, not only the transmission rates, but also what we learn about COVID. I think those are the two things that influence our decisions. So as the more we learn, the more we are informed about the best path to move forward to provide school for students in a safe way.
NBC Connecticut.
Good afternoon, Governor. Regarding your new travel quarantine policy regarding the fine, how are you planning to enforce that when people leave the airport? And is it possible that someone could get tested before arriving or after to avoid the quarantine completely?
Yes, you can get tested and show that you tested negative. That's correct. But otherwise, I think it's one more way that we can remind people that we're taking this seriously. When we have to impose that fine, we'll see. No plans on that right now, but at least people know there's a possibility and there could be some penalties, so they'll be serious about taking the quarantine seriously.
And for Dr. Ko and perhaps Commissioner Cardona, regarding that South Korean study that seemed to show that older children are more likely to spread COVID than younger children, does that have implications for what grades reopen and how? Is the plan changed in any way due to that?
So we recognize, when we developed the plan, we knew that facial coverings would be a critical component to it, and the use of facial coverings is a big part of the plan. It's something that, as the plan was being developed, the data was, the research wasn't as clear as it is now, but we still were not sure, and we were not taking any chances. We felt facial coverings is something that has helped Connecticut get to where it is, and we know that has to be the culture of our state as we're educating students so that we can reduce transmission. So while the study did not, I learned about the study earlier today myself. While the study didn't change our plans, it reinforced the fact that we need to make sure that we're helping our students during the summer prepare for school with facial coverings as the norm. And that's a statewide effort. And we've been able to do well in Connecticut following those rules. I think we can do well reopening schools carefully.
And Commissioner, you talked about the hybrid option, parents not ready to send kids to school. They have that option to keep kids home. Will teachers have that option? They could be part of the vulnerable population. They could live with someone who is, would some districts be allowed to choose a completely remote teaching model if they wanted?
Sure. So I've heard from so many teachers, and I want to just acknowledge that I hear you. I'm listening. I understand the challenges that this poses for you. I recognize that this was thrust upon you without, this is just something that now we all have to deal with. And for some of you, there's a greater risk than for others. We also recognize that in some cases, we're going to be able to provide opportunities for teachers to teach remotely. But we also recognize, like I said on June 25th, that may not be the case in all cases, and that we have to think about how we can best accommodate as much as we can while trying to see how we can bring folks in where they feel confident and safe that they're able to work safely. And, that's a challenge. There's no easy answers here. Let me just tell you, there's no quick answer to this. There's no easy answer to this. In my conversations with commissioners throughout the country, we're all trying to do what's right for our students, but also our educators, who are the backbone of our profession.
Thank you.
Fox 61.
My first question is for the commissioner. I know you said August beforehand, but around what time in August could parents see an official decision on if we're looking at a full reopening or that hybrid option as being the final say?
Thank you for the question. The decision is not going to rest on the Department of Education solely. We're going to be consulting with our partners at DPH and ultimately the governor to make decisions based on which form we're going to take. The fact that districts are planning for 3 different models gives me relative confidence that, while there's going to be tweaking needed, we have options to start with. And right now, the data suggests that Connecticut has a pretty successful, trajectory around controlling the spread. We're going to keep our eyes on it, and hopefully by early August, where folks have enough time to plan and execute the plan that is selected. I think early August, giving them enough time is reasonable.
And then switching gears, Governor, the outage at the Department of Labor that happened on Sunday, will that be impacting any unemployment claims filed this week? Could it cause a delay in processing?
Yeah, I think there is some catching up we've got to do there. Paul, can you speak to that?
Yeah, no, the team's still evaluating it. The systems are back up. We're hopeful at this point that there won't be disruptions, but the team's continuing to work on that, and we'll keep the public apprised if there are any impacts.
The Associated Press.
Thanks, Max. Good afternoon. Maybe Governor, or maybe Josh, this whole thing with the testing and the false positives, do we know if any nursing home residents who were tested positive were erroneously put with other nursing home residents that were accurately tested positive?
We don't yet know that. As I mentioned, our DPH epidemiology and the FLIS team, the licensing team there, have been in contact with every clinician responsible for one of those individuals, including the facilities at which they're housed. They're compiling that data and they're providing tailored recommendations based on the specific circumstances. But we don't yet have the answer to that question, but we'll share it as soon as we do.
Okay, thank you. And Dr. Koh, I'm sure you're aware of this situation with this Thermo Fisher testing system. We've heard of other false positive issues in other states, like Rhode Island had one, I think, with, well, I know Vermont had one, I think, with rapid testing, and Rhode Island had one. Is Connecticut's problem, is this a unique one, or is this something you're seeing around the country with false positives?
Yeah, no, thank you for that question. I think the important issue here is that, or the concept here is that, no test is perfect. There's not a test which is 100% sensitive, which means that it's going to pick up every true infection that's out there, and there's no test that's 100% specific, which means that it won't call a false positive, as this case. But let me say two things. So for that reason, in a state like ours, which is using large-scale, intense testing to keep down transmission, we are going to have false positives. And that's going to happen even in the best of tests, because none of them are 100% positive. So I think it's kind of the careful investigation that the Department of Public Health did that's going to kind of really, really confirm whether an infection is real or not. And that ultimately is the decision of the clinician, people like myself. This happens commonly with tuberculosis. It happens with HIV. I think this situation here, requires a special call out or shout out to the people at the State Health Laboratory and Dr. Razik and his group, because what they found was actually a systemic problem, with the Thermo Fisher. So the Connecticut here picking it up not only helped the issues of people in the nursing home, but it also helped people all over the country who are using that test. So I think that's an important point to make. And I think, this is the time to really learn and to correct those mistakes, whether it's made by the type of tests that are being used or so forth, any procedures, because with the kind of careful investigations that the state is doing.
And is this test very common across the country?
Yes, it's a test which is being used in many labs throughout the country, in many commercial laboratories.
Thank you very much.
CT News Junkie.
Thanks, Max. Was not on it today. So, Dr. Koh, I don't know if you know anything about this situation, but when Israel reopened its schools is when it saw a second wave of infections. Does that concern you?
Yeah, so that is concerning, of course. And I think it's concerning for some of the reasons that I think Miguel had just commented on and what I had initially responded to the governor about what's happening in Korea. And let me just say one clarification. So the data, and this is probably the best data out there that's coming from Korea, that actually showed increased rates in kids 10 years and above. So that's our middle school, that's our high school. It didn't see that. And actually rates were lower in kids in terms of their ability to transmit to other people in the household. It was lower for kids who are 10 years of age. And I think just as an aside, I think that makes it, important that, that the kind of interventions, whether it's the face coverings or whether it's the social distancing, we need to keep a high bar, until we really learn, we have enough evidence. And I think what Miguel and the state is doing in terms of really doing what's right for kids, not only that are above 10 years of age, but lower, is important. I think the situation in Israel is a little bit difficult to essentially disentangle. It could be what we call true, and related. They had done a fantastic job in controlling their initial surge. I think this is the cautionary tale for people like, for Connecticut in the Northeast. They did an exceptional work, controlling transmission, and then they opened up, and they opened up quickly. And so a lot of things opened up at the same time, not only schools, but businesses, social mobility, contacts, and so forth. So it's kind of hard to disentangle if one, if it was the schools that, actually fueled the transmission, in the community, or vice versa. I think it's probably a little bit of both. And you know, they have crowded schools. They have a lot of people that went to school. It wasn't in all their schools. It was just in several of them that they had this type of outbreak. But I don't think we really can tell now, you know, if schools are going to drive transmission in the community.
The only thing I'd add to that, Christine, if I could, is you can point to Israel, but as Dr. Koh said, their metrics were not trending in the right direction when they opened. They opened up their economy and their schools much earlier in the process than, say, a state like Connecticut. I like to look at, you know, a dozen plus countries in Europe that followed the metrics as they kept down, low infection rate. Only then did they open, and they've had a pretty good track record to date, opening in a different variety of different ways they've done it, the hybrid, small class, whatever, but they've done it.
And Governor, can you tell me about your decision to not give nonprofits any coronavirus relief fund if they've received a PPP loan?
I'm not sure we've made that determination. So let me take a look at that. Melissa McCaw, our commissioner, is going through all of the not-for-profits right now, seen who's been on the front lines, who's been impacted by COVID. You're right, we did take a look to see who got PPP loans, because that obviously helped tide them over a little bit, but that doesn't preclude them from also getting some COVID relief money.
Okay, thank you.
The Connecticut Mirror.
Thanks, Max. Can I go back for a minute to the false positives? Because during the press conference, Commissioner Gifford acknowledged it certainly was likely, given the procedures the nursing home established, that there were definitely some people who had the false positives who would have, following the procedure, been housed with the coronavirus infected patients. Can we say definitively that none of these folks got sick, and do we know if any of these patients, since they were tested, if they've passed on?
Keith, as mentioned a moment ago, we don't have yet complete understanding from all of those cases, you know, what happened after that false positive. So, as I mentioned, the team is doing the work to determine each of those cases, and when we have more information, we'll share it.
Okay. Just in one other area, going to the 14-day quarantine, Governor, so much of this hinges on voluntary compliance, because if we have people driving into Connecticut, unless you're going to have folks stationed at the border at every road stopping people, you're counting on them basically doing the right thing and self-quarantining. But are we sure we really have all the teeth that we could have? The one example I want to ask you is, what if people go out of state, whether it's on vacation or whatever, and they go to a hotspot state and they come back and they want to work? Does an employer have the right to actually say, you must go home and self-quarantine? Or can that worker actually file a labor complaint against the employer for not allowing them to return to the job?
I think what is going to be an executive order is very clear. You go to a hot spot, you come back to this state, you either have a test that shows you tested negative or you must quarantine for 14 days. And I'm glad that employers will be helping us to enforce that.
Are you saying that is what exists now, or are you saying that's where you're headed with your executive orders? Because what I'm hearing is I hear the employers can't get a clear answer from labor officials about what they're empowered to do or not to do.
We're going to issue an executive order, not guidance, but an executive order. I think that's tonight or tomorrow, that will clarify that in no uncertain terms.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Can I ask Dr. Koh, please, whether you think that younger people are responsible for the rise in the state's rate of transmission?
Yes, that's an important question. It's unfortunately a question that we really don't have a good example or hard evidence at this point. We suspect that's the case. You know, we've seen, you know, in places that have done extensive testing, like in Korea, like in parts of Europe, we've seen high proportions of test positivity in that 20 to 29-year age group. That kind of makes us suspect that this may be what we call a reservoir, that transmission is occurring in this age group, and that's spilling over to our elderly and into our middle-age groups. But at this point, we really don't have that kind of comprehensive look to know that. But certainly, I think if you go back to the ABCs, increased social contact, close contacts, without, use of face masks, that's a setup for transmission. And I think that's played out, what we're seeing in this, specifically in the South, since their reopening early in May. So that's certainly, I think, irrespective of age, those are going to be kind of the important factors. And I think these are the important issues that, we need to deal with, at least in terms of public health, and getting, whether they're 20 to 29-year-olds or other groups, to really do their job in terms of public health prevention.
Governor, do you think that uptick in the rate of transmission is alarming or troubling for you? I mean, I was looking at that map. It seems to be that people are lax and they're not wearing masks, a lot of people.
Well, here in Connecticut, I'm surprisingly happy that our positivity rate has stayed as low as it has for as long as it has. And but that is the key metric that I watch like a hawk. But you're absolutely right. As I look around the rest of the country, it's like a hockey stick in a dozen of these states right now, and you can see how fast things can change. You're absolutely right.
Governor, there was a rally outside the Capitol today, kind of led by the DACA people, asking for expanded Husky coverage, another $150 million for undocumented families, and the outright cancellation of rent. Does any of their arguments resonate with you or prompt you to action?
Yeah, it reminds me that people are really hurting badly. And, we spent a fair amount of time today talking about what the next supplemental coming out of Washington is going to be. And high on that list was rent support. Because people won't, just because we had a grace period for rent, Ken, over the last, several months, not necessarily that everybody's been saving up to pay that lump sum now. So we've got rent support in our budget, and I'm hoping that the feds are going to be able to help us multiply that several-fold so we can negotiate with the landlords who can find a way for their tenants to be able to continue to stay right where they are even after our late August end of eviction period.
Thank you.
The Hartford Courant. The Waterbury Republican American.
Thank you, Max. A question for Dr. Coe. We've been hearing from readers who are asking us why teachers and students shouldn't be tested for COVID before the start of school and periodically through the school year. What are your thoughts on that?
I think, so my thoughts in much of this has been, I think an evolution for all of us, trying to understand how best to respond to the COVID epidemic. But I think my thoughts are exactly the same as I think what Miguel has proposed, as what Commissioner Gifford for the DPH have proposed for K-12. The most effective way that we're going to keep our schools safe, keep our teachers safe, to keep our staff as well as the students safe, is by controlling transmission in community. And the most important part in controlling transmission in the community is going to be having people who are symptomatic, even with mild symptoms, and people also in the highest risk communities that we have, our kind of crowded urban centers, kind of the whitish spots on the map that the governor showed, having them become tested and then going through contact tracing if they're positive. That's the most effective way. For this group for the group of people or segments of the schools, whether it be teachers or schools and so forth, testing is not going to be kind of like the Berlin Wall or the kind of the barrier, the 100% barrier. And that's because our tests, many people in the beginning of when they gotten affected are not showing virus, they're not secreting virus. So the sensitivity of those tests aren't great. Even with intense testing, this is not, these aren't 100% guarantees that we can create this kind of hermetic seal or this barrier to prevent people from getting tested. So I think, the answer is, and I think this is in line with what the state is implementing, is that we really do the best job we can in our communities to keep our schools safe.
And what's your sense of how the reopening in Connecticut has been progressing?
Well, I think, I'm as many people know, kind of, and I think my job as somebody in public health is to be a little bit more on the pessimistic side of this, or the cautious side. And so I am always trying to be careful about, how we're doing. But I think, but it certainly we are in the, I think we have the fundamentals correct. We're testing widely. Our test positivity are low. And as long as we can keep those two things, we can keep the testing up so we can detect outbreaks. And if we can do our best, as the state is, to protect the most vulnerable people in our communities. And these are the people in the nursing homes. These are our underserved communities who took the biggest hits, during our last surge. If we can keep those fundamentals correct, I think we're going to be, I think we're doing the best job we can. I am worried about, as the governor is, and with all the travel, restrictions and the fines or the disincentives for quarantine, worried about the introductions that are coming in. We know these are happening, and that makes it ever more critical that we keep our testing up so we can monitor the situation.
And for Josh and the governor, can you give us I've forgotten what percentage of tests are being done by the public health lab. So I was wondering if you could provide us with that information. And also, what is the level of concern? Because this testing flaw was discovered during a period when mandatory testing of nursing home staff and residents was taking place, and also later on assisted living facilities. So what's your level of concern as you wait to hear back to find out how many other labs in Connecticut use this Thermo Fisher Scientific test, and even the DPH isn't certain how many false positive tests there may be in the state?
I'll start, and then, per usual, hand it right over to Josh. But I would have been really concerned if this had happened and we hadn't detected it, if we hadn't caught it, if somebody else had done that, if we hadn't been transparent and shared it right with you. So I was very happy that we did do this. We found out about it. We're getting everybody the second test and addressing it forthright with people. Josh?
Yeah, and just to put it in context, as I mentioned, the State Public Health Lab ran about 2,200 tests on this platform over the course of the month period we're discussing. And over that same period of time, we reported at the statewide level, I believe about 270,000 tests. So roughly, less than 1% of the total testing going on. Now there's risk though that this platform is being used by other laboratories, as Dr. Koh alluded to, that could have similar issues. So that's being investigated as well. But the State Health Lab does a very small percentage of the overall testing results that we report.
So then you're not overly concerned?
I'm sorry?
So what's the level of concern?
Well, anytime there's a false positive like this, we're concerned. And so that's why the team is following up on it. They work straight through the weekend investigating it and working with the clinicians to take necessary actions.
Okay, thank you very much.
The Hartford Current.
Hi. Question about the long waits that people are experiencing for testing. Are you concerned about that? And then one other question regarding the fines. What types of information will you use to determine when those fines will be assessed?
Well, I'll start with the latter, which is we're going to have folks from our Department of Public Health at Bradley Airport, and we're going to tell people compliance is mandatory. And I'd like to think, given our experience over the last 4 months, that people will follow that and there won't be any issues. If we find people are consciously not following that, then we let them know that fines are a possibility.
And I'll just like to add one other thing. The governor signaled last week that this was the direction that the state of Connecticut was going to go in, and tasked the Department of Public Health, led by Josh Jabal, to come up with not only the strategy but the implementation plan, and that's what today's announcement is. So I know that there's been news out there and various things saying that there's been a reversal of position, but the position the governor stated was the one last week, and this is the one that we're unveiling today.
Yeah, and just to continue to add to that, I mean, obviously, compliance with all of our laws, we rely heavily on people to obey those on their own, right? So where we find referrals where people aren't adhering to this, they'll be dealt with. But to get to the first part of your question as well, with regards to testing delays, we have heard some reports of that from some private testing providers. We did a spot check today with all of the labs that the state has under contract directly, where we're supporting testing with the vulnerable populations Dr. Coe referred to, consistent with our testing strategy. So the federally qualified health centers, the nursing home testing, corrections facility testing, and so forth. All of the labs that we have under contract with the state of Connecticut are continuing to perform very well with testing turnaround times, most cases 24 hours or less, in some cases less than 48 hours, but nothing like what's been reported from some of these other providers. And that's including with our testing being done with Quest Diagnostics, where we have what's known as Priority 1 testing access, and I know some of the other major healthcare partners in the state do as well. So we are aware that the national issues are causing challenges for some of those large commercial labs out of state. So we are working with some of those providers to look for opportunities to move those volumes from those less preferential out-of-state contracts to our in-state laboratories, who do in some cases still have capacity available to take more tests and are demonstrating that even in the midst of this difficult time nationally, they're turning those test results around very rapidly for the citizens of Connecticut.
All right, I think that looks like it's a wrap. Let me just say, I've heard a couple things. One, usually we're heading into the dog days of August sometime around now, where you can put your feet up a little bit, and you can still do that. Obviously, it's better if you stay close to home or don't go to a highly infected state. That's message number one. Number two, I think there's still a lot going on. You hear from Dr. Coe. He frankly says he's a little bit on the pessimistic side, a little bit on the cautious side, which is why you are here, and working closely with Miguel and following those infection rates and following the positivity like a hawk, looking for any potential flare-ups and putting up the flag as necessary. Miguel is going to be very busy because on Friday, just a few days from now, we're going to hear from the superintendents. We really think it's so key if we can get those kids back to school, but only if we're going back to school safely. That's priority number 1, 2, and 3 for us. And we're going to have a very clear indication of what things look like within a week, but then we're not going to be able to tell you for sure for another few weeks thereafter, just as we follow with Dr. Coe what's happening in terms of rates around the state and around the region. And finally, there were a number of questions about the economy and rents and the such. This is a really important time. I is following this, and we're all following this. Miguel is looking at this. The universities are looking at this. Melissa is looking at what's going to come out of the Senate. They're going to be presenting their bill to their members, the Republican side, probably as we're speaking right now. And it's so key as we figure out how we can get our economy back to a glide path where people can safely get back to work, Renters know that they have a place to stay and we can take care of them accordingly. Universities know that we can, rebuild slowly what we've got going on there. Hospitals are waiting to see if we can help back them up as well. So these are supposed to be the dog days of August, but they're going to be pretty busy. But I want you to know you've got Albert Coe, Miguel Cardona, and some folks paying special attention to this every day. Thank you, everybody. Good to see you.